Good afternoon, folks. Now, today's topic B deals with innovation in wound care for diabetics. Here we go with the explanation I did for you. Please sit back and enjoy. A real-time smart dressing patch developed by KAIST researchers could significantly reduce the risk of diabetic foot amputation by enabling continuous non-invasive monitoring of wound health. What the smart patch does: monitors key biomarkers in real time: glucose, pH, acidity, and temperature, all of which signal whether a diabetic foot ulcer is healing or worsening. Changes in color. When wound conditions deteriorate, allowing patients to visually detect danger signs early, uses in embedded LED and photoid to measure color changes more accurately than a smartphone camera, improving diagnostic precision. Operates without a battery, powered instead by NFC. When a smartphone is brought near the patch, translates data directly to a smartphone, giving patients and clinicians immediate insight into wound status. Why this matters: diabetic foot ulcers are notoriously difficult to monitor. Delayed detection of infection or tissue deterioration is one of the leading causes of lower limb amputation in people with diabetes. This patch aims to catch problems early, long before they become severe enough to require amputation. The technologies combination of real-time sensing, non-invasive monitoring, and patient-friendly design could dramatically reduce fear of uncertainty for millions living with diabetes. A real-time smart dressing patch is emerging as one of the most promising technologies for preventing dangerous diabetic foot ulcers from progressing to amputation. The headline you shared refers to a led breakthrough, a wireless, battery-free op electric tech multimodal sensor patch that continuously monitors wound chemistry and alerts patients early when conditions worsen. What this smart dressing patch actually does tracks multiple biomarkers in real time: glucose, pH, and temperature. All key indicators of whether a diabetic ulcer is healing or deteriorating. Color changing monofiber dressing signals danger visually when glucose or acidity levels rise, allowing patients to spot problems without equipped. Embedded LED photoid measures color changes precisely, avoiding errors caused by ambient lighting that affect smartphone camera readings. Battery-free operation. Using NFC, the patch powers up only when a smartphone is brought near, then transmits wound data instantly. Why this matters for diabetic foot care. Diabetic ulcers are notoriously difficult to monitor, and missing the early signs of infection or tissue breakdown is one of the biggest drivers of lower limb amputation. This patch aims to catch deterioration early, long before visible symptoms appear. It enables non-invasive long-term monitoring without blood draws or frequent clinic visits. It gives patients real-time feedback, reducing dependence on self-reporting or delayed lab results. It could significantly reduce fear of amputation, one of the most devastating complications of diabetes. How it fits into the broader wave of smart wound care. The KS patch is part of a rapidly advancing field of intelligent wound monitoring technologies. Georgia Tech's nitric oxide sensing smart bandage tracks a key healing biomarker to detect early trouble in chronic wounds. Penn State's multi-sensor chip detects pH, uric acid, bacterial metabolites, bolites, and inflammatory proteins, offering a broad biochemical picture of wound health. Targeted microchondrial therapies are being developed to restore cellular energy and accelerate healing in diabetic wounds. The KS Smart Dressing Patch represents a major step toward active, real-time, personalized wound care by combining a color-changing microfiber dressing with precise optoelectric sensing and smartphone-based monitoring. It could dramatically reduce the risk of missed warning signs Here is a clear page anchored explanation of the text. The future of healing smart bandage could transform diabetic wound care and beyond, grounded primarily in the content from your open document. What the text is saying in plain language. The text is describing a new generation of smart wound care technology, specifically a smart bandage or patch that could dramatically improve how diabetic wounds are monitored and treated. The surrounding page content gives us the context to understand why this matters and how it works. Why this technology matters for diabetic wound care. Diabetic foot ulcers are extremely difficult to monitor and often worsen before anyone notices. Missing early warning signs is one of the biggest reasons people with diabetes face lower limb amputations. Diabetic ulcers are hard to track, and early deterioration is often visible to the naked eye. The smart bandage aims to change that by catching deterioration early before visible symptoms appear, allowing non-invasive long-term monitoring without blood draws or consistent clinic visits, giving patients real-time feedback, reducing dependence on delayed lab results or self-reporting. Reducing the fear of amputation, a major emotional and medical burden for many diabetic patients. In other words, this isn't just a gadget, it's a tool that could change outcomes and reduce suffering. What makes this bandage smart? The surrounding content describes the Cassis developed smart dressing patch that combines a color changing microfiber dressing optoelectronic sensors that read biochemical changes, smartphone based monitoring, where data transmits instantly when a phone is brought near the patch. This creates a system that can detect subtle biochemical shifts long before the wound looks worse on the surface. How it fits into the larger smart wound care movement. The page places this casist casist patch within a broader wave of innovations. Georgia Tech nitric oxide sensing bandage tracks a key healing biomarker to detect early trouble in chronic wounds. Penn State's multi-sensor chip monitors pH, uric acid, bacterial microbes, and inflammatory proteins for a fuller for a full biochemical profile of wound health. Targeted mitochondrial therapies are emerging to restore cellular energy and accelerate healing in diabetic wounds. Together, these technologies signal a shift toward active, intelligent, personalized wound care. The text is pointing toward a future where wound care is real time, personalized, non invasive, data driven, integrated with everyday devices like smartphones. Okay, guys, that is your B for today. I will see everybody tomorrow for one show tomorrow morning. Okay, so everybody have a good Saturday. I will talk to you later. For now, Gator Wellness, take care, folks.